Here at the Melanin Initiative, we simplify medical information into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective. Today, we'll be speaking with our special guest, a woman whose story challenges what we think we know about resilience, patient advocacy, and life saving power of community. Simone Washington was diagnosed with end stage renal failure at the age of 24. Now, she's a 15-year kidney transplant survivor, author, and nationally recognized patient advocate. This is a conversation about life, loss, resilience, and hope. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts here at the Melanin Initiative, along with Alicia and Geraldine, who send their love in their absence. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and then to use it, to manage your health and advocate for others. We have two missions here. The first, to promote that health literacy amongst the public. The second is to elevate the expertise of nurses, to bring awareness to all the diverse career opportunities in the healthcare industry, and then to let our peers know all the ways that they can leverage their expertise, both as clinicians and entrepreneurs. If you haven't already, this is your invitation to subscribe, leave a comment or two, and share this information with people who you think might benefit from it. Every time you interact with our platform like that, it lets the algorithm know that this information is important, so that when people like you look for topics like this, we'll show up higher in the search results. Remember, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you think you might be experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you think you might be having a physical emergency, you should call 911. If you or someone you know might be having a mental health emergency, you can call 988 or text 741 741. Today, I'm honored to welcome a woman whose story embodies faith, grit, and radical hope. Simone Washington is a kidney transplant survivor. At the age of 24, she was diagnosed with end-stage renal failure, and instead of shrinking, she stepped into her calling. In her book, The Best of All Things, a tapestry of faith, hope, resilience, and the human connection, Simone intimately shares her 6-year battle from diagnosis to transplant and how that experience transformed her life and purpose. Now, 15 years later, she serves as an ambassador with One Legacy, one of the top organ procurement organizations in Southern California, using her story to uplift and empower others living with chronic illness. What I admire most about Simone isn't just her survival, it's the way she's turned her survival into advocacy, something we really love here at the Melanin Initiative. Education and a platform for those who often overlooked in conversations about organ donation and chronic disease management. From Cairo to California, Simone is proof that a second chance at life isn't just a blessing, it's a responsibility. Today, we're unpacking your myths, fears, and the facts about organ donation and transplant advocacy in our community. And by the end of this episode, you'll realize why your one yes could literally change a life. Simone, welcome to the Melanin Initiative. We're so grateful to have you with us today.
Thank you so much for having me. That was an amazing introduction. Thank you so much.
Yeah, well, the facts are the facts, and that's the life you've been living.
Thank you. I appreciate it.
Yeah, I'm super delighted to bring this your story to the show. As many people who've been following us for the last 2 years would know, this show was inspired by a gentleman I was taking care of in his mid 60s had just had a catheter placed to start dialysis. And talking to him and realizing he didn't really understand what led up to that motivated me to start this show. And much like we see the boom with financial literacy, that same lack of knowledge and education is prevalent when it comes to managing our health. And more intimately, for me, my dad was on dialysis for several years before he also received a transplant on January 1st, 2020, a year that changed all of our lives. And
Yeah.
he's doing quite well today. He still has his own, things that he still has to manage. It's
Mhm.
certainly not a one and done. And he already had quite a few things to manage before that. And so, but otherwise, he's doing well. He was able to retire after that. He's a huge supporter of the show and always giving me ideas, sending me his doctors so they can be guests on the show and
Awesome.
promoting things and really getting into it. Him and my mom have been huge supporters. And so I know they're going to love your episode. And I know you're going to change lives with your story.
Thank you. I'm so happy to hear both stories. And yes, so that is why I wrote the book. That is why I became an ambassador, just to share my story and put a face to the cause, which is so important, especially for our community. we are the most in need of transplants, and we are the least number of registered donors. So I want to do my part to try and change that and improve it.
Wonderful. So, as you know, before we get into our conversation, we're going to get to know you a little bit better with our icebreaker. So, we have 5 questions in 5 minutes. Okay. Don't overthink it. This is supposed to be the fun part.
Yes, I'm excited for this part. I've seen episodes and I can't wait.
Okay. So, first question: what's one thing you're being intentional about this week?
One thing that I'm being intentional about this week is improving my overall health. So, I've recently started working with a personal trainer. So, being more intentional about exercising on purpose, and also working with a nutritionist who is bringing awareness to me on the importance of paying attention to the preservatives in food. So, going through this journey, I've learned to read labels, but I hadn't been paying attention to preservatives. So being intentional about that.
Oh, we love it. What's the
Yes.
next big idea you want to be a part of?
The next big idea I want to be a part of is finding the next level, the next way to continue to bring awareness to this cause and just amplifying my voice in the various ways that it can be. So stay tuned.
The most important thing you've learned about communication?
The most important thing I've learned about communication is that it looks differently for everyone. Um, Saying that communication is important is one thing, but understanding what that really means for each person that you're communicating with is something completely different and something that we have to be intentional about learning as we're getting to know each other.
I couldn't agree more. It's like a dance, and every partner, you're starting from scratch.
Yes, yes.
Something you use every day that makes your life easier.
Something I use every day that makes my life easier, of course, is my smartphone. I can't live without it.
So I'm curious because I know in our brainstorming we kind of talked about AI.
Yes.
Any ideas or what you see happening in AI in your space in particular, how it's being utilized, or concerns or questions people have?
Yes, so being a new writer, I'm in groups with other writers and having conversations around how AI is impacting the writing space. And so I'm really encouraged to hear about the different ways that writers are incorporating AI tools to actually preserve the essence of what writing is and using it as a tool to get more stories out there for people to read.
Wonderful. And lastly, my favorite question: what season are you in now?
Ooh, well, because it is the first day of summer and because I just turned 45 last month, I would say that I'm in my summer season. So, not a spring chicken anymore, mature in life experience, but not older, not of a more mature age. So, right in the middle of summer.
Oh, wonderful. We love it. And happy birthday.
Thank you. Thank you.
Okay, so as our audience has started to become accustomed to, we've introduced these case studies into our conversations to make them more relatable, to remind us to use language that everyone understands, and hopefully people can kind of witness how we're talking about it to get
Mhm.
idea, give them language. So when they're the one, either the patient or the advocate or the caregiver, they feel a little bit more equipped on how to ask the right questions, get answers, and feel comfortable doing both of those things.
Yes.
So let's meet Deidre. She's a 28-year-old teacher, recently diagnosed with end-stage renal disease. She's in shock, overwhelmed by dialysis schedules, and hesitant about joining a transplant list. She's
Mhm.
worried about myths she's heard in her family, like if she registers as a donor, clinicians won't work as hard to save her life. She's also navigating friendships and relationships as her health changes. During our conversation today, Simone will share her expertise and walk us through what Deidre is facing and what she needs to know. So, first, let us know when you were first diagnosed, what was going through your mind and what was the scariest part for you?
When I was first diagnosed, I was super afraid. I didn't know what to think. I had never heard of this diagnosis before. I didn't know what it meant. My immediate thought was that I'm 24 years old and I might be dying. And so that was my first thought.
And how did they explain end stage renal disease to you? Had you been familiar with any of those things?
No, I didn't know what it meant. I had no idea what part of my body was being affected by it. I didn't know anything. What I was told initially is that at the time of diagnosis, both of my kidneys were working collectively at 10%. And if we didn't do something quick, uh, I would have some severe consequences.
Were they able to find a cause? Because you were very young.
Yes. So at the time, there wasn't an immediate cause found at the time. The focus was really on what medicines I needed to start in order to stabilize my condition, what our next steps were going to be after that. And the doctors did say that as we were diagnosing you with this, we also found out that you have FSGS. It's not related, but we found it at the same time. So, fast forward years later, there's more research, and the truth is that the FSGS did, in fact, cause the kidney failure. Um, I don't know if you're familiar with the acronym, it's a very long name.
No, and there's so many acronyms in medicine, and we make up more every day.
Yes, yes.
For the
So
public who doesn't know,
So the condition is the cousin of lupus, so it does affect things like rheumatoid arthritis. It could cause diabetes, and in my case, kidney failure. Um, yes,
and
I
you said
can.
FSGS,
Yes. So let me.
focal segmental glomerular sclerosis.
Yes,
Okay,
yes, that's it. I always struggle with that name.
and is that genetic?
It's not genetic. It's something that people are born with that usually stays dormant in our bodies until there's a huge stress event that happens to kind of wake it up and have it start. So that's what happened in my case. I was living on my own. I had my own apartment. I had just graduated from grad school. I had just started a new job. So everything was good. Um, but my apartment building got infested with mold, and that caused some stress. Working with the managers at the facility and trying to get them to clean it up, and that took a little convincing, and just the whole process of like wanting to get another place and all that back and forth, and then actually moving into the other place. So at some period in that process is when I started having symptoms.
Oh, okay. What were your symptoms?
So my symptoms were that I got really thirsty. So I was drinking a lot of water, drinking a lot of fluids, but I wasn't using the bathroom at the same rate. And so I was experiencing water retention. My ankles started to swell. Um, I got really achy all over my body, and my joints started to be achy. Yeah, it just seemed as if my whole body was just in pain just to walk around. And those were the symptoms. I couldn't keep any food down. I didn't know what was going on.
So our good friend Google here says, yeah, just like you, most of the time we don't know the cause. Uh,
Mhm.
Other secondary causes could be infections, certain medications, obesity, sickle cell disease, high blood pressure, and there can be a genetic component as well as mutations. And
Yeah.
did you have changes in your blood pressure too?
So at this time, I was just a typical 24-year-old. I didn't have any underlying conditions that I knew of. I didn't have anything other than the common cold. I never had to go to a hospital for any reason. So at that time, I was just going for my annual physical. And anytime that I went to do that, everything was fine. So for all intents and purposes, I was fine, and I didn't know that anything was going on in my body. But when I went to the hospital, when I was experiencing those symptoms, and they took my vitals, my blood pressure was through the roof. But because I was new to my job, I didn't have any medical insurance, so I was made to wait 22 hours in the emergency room before I was seen and ultimately diagnosed with end stage renal failure.
Wow. Now, even though the cause of your kidney failure was the focal segmental glomerular nephritis, glomerular sclerosis,
Mhm.
The symptoms are quite common anytime we see the kidney failure. So, Deidre's here. She wants to know, they've given her a lot of information and she's a little
Mhm.
bit overwhelmed. And she
Yes.
wants to know, now that you've been in this space for 15 years, how would you describe what's actually happened to her kidney? She said it's failing. That sounds pretty scary.
Yes. And I was already in stage at that. So um, definitely paying attention to blood pressure is one. If you have underlying conditions like diabetes, arthritis, or any other of those things, those are ways to kind of know. Um, the amount of water intake you have daily is important because even in with my transplanted kidney, the amount of water that I intake daily is important and it matters for its function. So a healthy amount of water per day is really helpful. Exercise is always helpful. Um, so yeah, those are some things that can help.
Okay, so we know the kidney's job it's actually considered a major organ, even though the brain and the heart tend to get a lot of attention. Once you kind of enter the healthcare system, you learn really quickly the importance of the kidney and the liver. And
Mhm,
so when you hear the word failure, that means whatever that organ's primary job, which is filtering everything all your blood passes through the kidney. And so your blood absorbs things like oxygen, the food that you eat, the cigarettes that you're smoking, the alcohol that you're drinking, medications, everything. And so
mhm,
when that's not able to do that, just like she described, that fluid backs up because usually the kidney would excrete that in the form of what we call urine,
mhm.
depending on how old you might be.
Yeah.
The color of that urine is typically a good indicator of how hydrated one might be. So if
Yes.
the kidney's job is to filter and to excrete fluid known as urine, and it doesn't do that, well, that fluid goes somewhere, it backs up into your body. That's the swelling
Mhm,
we're talking about. And when those blood vessels are full, that volume goes up. The room for the blood to take up goes down, so the pressure goes up. That's why the blood pressure goes up. And if you're not getting rid of that fluid, she said she wasn't peeing anymore. So when you
mhm,
the way the body is designed to work and it fails to do that, you can kind of walk your way back. This is for my students as well. When you're
mhm,
learning all the different organ systems, if you can then walk your way back to what you
mhm,
can expect to see in terms of symptoms or what the patient might complain of. So yeah, you might feel tired, difficulty breathing, shortness of breath, uh,
mhm,
and we typically see this in patients who have maybe an acute issue where the organ can still be reversible, the damage, or when we're at that point where you were, where it's at the failing stage, end stage renal disease or
mhm.
kidney failure. So
Yes.
Deidre has a better understanding now of what's happening to her organ, and now she's hearing this word dialysis. What would you explain to her why this is being recommended and what she can expect?
Yeah, so dialysis is exactly what you explained. It is doing the job of what a healthy kidney would do, which is filter through the blood to clear it out of all toxins and extra fluids. And so it's a machine that does that for us in the case where our kidneys are not able to do it for us.
Yeah, and maybe I'll make a little note here. Angie, throw up a little graphic for us while we're talking so people can see. I'm putting a note here. Angie's
Yes.
our producer. Shout out to her
Yes. Okay.
to overlay a graphic so people can see what dialysis looks like.
Good.
Okay, so yeah, so she's on. So what's this? What was the sequence? So you got the diagnosis, then they mentioned dialysis. What happened after that? Did you get a catheter placed? Did you stay in the hospital?
So when I first got diagnosed, I stayed in the hospital for 2 weeks for the doctors to manage the medicines for me to take home with. So while I was in the hospital for those 2 weeks, I had an emergency catheter inserted in my neck so that I can start receiving emergency dialysis. Later, the catheter was moved to my chest, another longer temporary catheter so I can do dialysis. Um, and then during that process of being on the medicines, the doctors were talking to me about the next step being dialysis. And so have I put it off for as long as I could because I was afraid of it. I wasn't really sure what it was. I avoided learning about it. I just avoided the whole situation for as long as I could. And so I was on medicines for 2 years, one med for each year. And the doctors explained to me that after that time, the the side effects would outweigh the benefits of being on those medicines. And then I was required to do dialysis from that point. So before starting dialysis, I had to have a fistula surgically created in my arm to prepare me for dialysis. And a fistula is when an artery and a vein is tied together to make a larger port so that the blood can flow and be cleaned out in the process of dialysis. So I had surgery on my arm to create that. It took 6 months for it to heal and be ready for dialysis. And in the meantime, I was using the temporary port in my chest, which is temporary because it's a tube that's both inside and outside of your body. So it's prone to infection most of the time. So the longer you have it in, the more likely you will have infection. The tube goes very closely to your heart. So if you're infected, the infection goes to your heart. So it was perfect timing because by the time my fistula was ready and they took the catheter out, I was starting to have signs of infection from the chest catheter.
You did a beautiful job explaining that. Yeah, I love that. Thank you so much. So Deidre feels that she's starting to kind of get an understanding now. She's feeling a little bit more comfortable. But with all of this going on, she's like, look, she's not even 30. She feels like she's losing her identity. As
Hmm.
someone who went through this, what advice would you give her about holding on to herself while managing this illness?
Well, I can honestly say that when I was going through this process, I was feeling the same way as Cedra. Although I was going to work, I still worked full time. I worked at an elementary school, and after school, I went directly to dialysis 3 days a week, 4 hours at a time. After dialysis, I was tired and hungry. So after I ate dinner, I went to sleep and then I went to work the next day. So that was my life. I didn't have much of a social life at that time. I didn't feel good about the way I looked. My skin was darkening. And there's nothing wrong with dark skin. However, darkening of my skin because of dialysis looks different. It looks the visible evidence of being sick. Um, I didn't feel pretty. I didn't, I had bandages on my arms from dialysis that I had to walk around with. So my self esteem was pretty low. I didn't have much of a social life, and my life was just all about staying alive and going through treatments and doing everything that I needed to do that the doctors had asked me to do.
Yeah, you're bringing up such really good points about the physical part, right? Because all of us go through something, but some things we can hide. And dialysis is a really tough one to hide because you have that catheter. Sometimes the catheter, for the most part, it can be pretty invisible. The
Mhm.
patient feels like everybody can see it, though.
Yes.
But the fistula, depending on where it's placed, most people will have it placed in the upper arm.
Mhm.
Again, you kind of get away with it depending on how your body is shaped. My
Mhm.
dad, his was quite all the way down near the wrist. And
Yes.
so if it's hot like it is today and you want to wear a short sleeve shirt and you're 28 or you're 24 and you want to go dating or you want to go to a picnic, it's going to make you feel a certain way, right? And yeah, that darkening is not the same as a dark complexion. It's really
Mhm.
like people can look at you and see something's going on. It's not bright and glowing. It's
Mhm.
and the people who do know you definitely notice there's a big change, and you're seeing it. And how you feel, how you look at yourself is also impacting how you feel. And that is tiredness after dialysis. Most people who go on dialysis stop working, right? They
Mhm.
end up getting on disability because of how time consuming dialysis is and how the medications make you feel. My dad, like yourself, continued to work all those
Mhm.
years up and down the highway commuting, and he was exhausted from the commuting, from the working, from the disease itself, from the dialysis, the medication side effects, and so that impacted his quality of life for a
Mhm.
very long time. And you're talking about staying hopeful, right?
Yes.
It's quite challenging. So, how important is it for Deidre to build community while she's getting all these treatments?
The wonderful thing about my experience is the medical professionals that care for me. especially in the dialysis centers. They were always so positive, speaking positive over me. Oh, you're so young, you're so beautiful, you have such a great spirit. You're not going to be here long. You're not going to need this treatment for a long time. You need to get your transplant. You'll be out of here in no time. Just always speaking positively over me at a time where I didn't have the faith to speak positively over myself or the situation. And so hearing from them all the time really helped. My family and friends, my church community, everyone praying for me and speaking positively over my situation. And hearing that so often helped build my own faith. And then I got to a place where I was able to speak positively over myself. So community is very important. Even the most faithful people, depending on what the situation is, faith can be challenged. And so we do need our community to help us remember who we are in Christ and remember that this situation is not impossible to get through. And so we need our community to help us with that.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1 minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
You're doing a beautiful job advocating and saying all the things that we want to bring home and drive home with our messaging today. So
Yeah.
we know that Deidre was concerned, and I remember dating a guy in college who said the same thing. If you put yourself on that list as an organ donor, they're going to stop taking care of you. Now,
Mhm.
fast forward a couple decades, I am a little bit more informed. But for Deidre, she's concerned, right? She said she's afraid that they'll stop taking care of her. How do you address this myth?
Yes, and I'm sure that you, as a medical professional, can contest to this. But the priority of a medical professional is to save your life, not someone else's. So, organ donation is only considered after someone has been declared dead by an independent team of doctors who are not involved in the transplant procedures at all. So, no need to worry there. You are the priority in your time of need.
Thank you so much. And since part of this show, we talk both to the public and to our peers, and we have a
Mhm.
lot of aspiring clinicians who watch and they're trying to figure out where they can make their mark in the industry and help people. When it comes to the transplant, you might work on a unit like I did, me and Alicia and Geraldine, where
Yeah.
we would prep people for their transplant. A real blessing and a privilege to be part of that journey. Um,
Mhm.
and typically, you'll have your first call, right? And you'll have your backup because sometimes the organ doesn't fit that person and you don't want to waste it because so many
Mhm.
people have been involved in getting that organ. Maybe they live in another state or across the state, and you might be a nurse that's on that flight, like my good friend Hannah. And she used to be a flight nurse and transporting organs to the destination. Then you might receive the patient and prep them for that. You might be in the OR with the surgeon as they're getting their organ. You might be in the recovery room helping them wake up. You might be in the ICU caring for them in those first couple of days while we're trying to make sure everything's clicking and ticking in the right places. You might be in the rehab facility as they start to recuperate and build their strength back. You might
Mhm.
meet them in home health where you're helping them to get back to their independent state and making sure they have all their medications figured out. You might be the social worker who's helping coordinate all of this care, or the
Yeah.
transporter who's helping them get back and forth to their appointments. So many different ways. You might be like our special guest here who's sharing their personal story as an advocate, speaking on a Capitol Hill, making sure policies are in place so that people who need the care get the care they need when they need it, and making sure insurance isn't the one that has the last say. So
Yes.
many ways you can help people. You can write. I love that, that's a big thing. I am a big writer. You can tell your story, you can tell other people's story, you can share facts. If you understand complex information and you're able to break it down and make it simple, people need that kind of information. So
Yes.
many ways you can help and make a difference, like you're doing with us today.
Yes.
So another belief we hear is I was born whole and I want to leave whole. How would you respond to someone? I hear that in our community, that's a big comment, right?
Yes.
How would you respond to that? And that whole thing about, we're going to die of something, everyone's going to die of something, right? It's kind of in line
Mhm.
with that same statement.
Well, I am met with that statement when I'm out in the community talking with people about this cause. And my immediate response is if everyone if everyone had that thought or had that opinion about it, I wouldn't be standing here before you having this conversation. Like I would be dead at 24 years old. And just being faced with that reality kind of helps to change the perspective because people are holding on with that ideology, but it's not rooted in like knowing someone who's in need or really meeting anyone who had a need. And so once when we're asking people to consider to be a registered donor, what we're asking is that, you know, when you have once you have lived your life to the fullest and now it's time for you to transition, we're asking you to give permission that your organs be used to help someone else live their life more fully. And it really is a personal decision, but you can absolutely come leave the world the same way that you came in. But how much have you helped someone else in that process? Here is an opportunity to leave a different kind of legacy, right? When we hear the word legacy, we think about the financial things that we want to leave to our kids or our family. But let's reimagine what it means to leave a legacy. This is your opportunity to save a life the way that a superhero would. And so, why not take advantage of the opportunity to save a life or 8 lives or enhance the lives of others once you have lived your life to the fullest?
That beautifully said. And yeah, you're right. You did mention as a healthcare provider that our primary mission is to save the life in front of us.
Mhm.
Yeah, we really aren't really thinking about who's on the organ list when someone's in front of us and they can't breathe or their heart stopped beating. That we're just thinking about right now. That's
Yes,
kind of what our training focuses us on. And then depending on really where you work in your relationship with that patient, you might not even know they're on the list
right.
until someone else comes in later after they've been pronounced dead. That has happened. Now
Mhm.
the conversation is okay. Let's see where we're going next, and that's
Mhm.
typically a totally different person that's actually taking care of you. And then,
Exactly.
yeah, they take over in the conversation and move on. But you are actually still caring. If you're particularly the nurse at the bedside, you're still caring for that body. Even
Yes,
your job isn't done yet. Just because the patient is dead, you're
right.
prepping them, allowing them to look presentable for their loved ones,
Mhm.
uh, making space for them to come and say their goodbyes. And then you're going to continue to look over that body until they're transported to the next destination, which might be the morgue. So you're still being cared for, actually. Uh,
Yes.
and so I'll just say that since you did bring that up, I think that's a very important point. And then you just lost your patient.
Yeah.
You're thinking about that. You're thinking about the family that's coming, how you're going to engage with them. Should you
Hmm.
go to the chaplain? You're still caring for them, right? And
Absolutely.
then you go to the next room who has a totally different problem and act like you didn't just go through that.
Yes.
Then you have to go home and care for your children and move on with your life, but you're still going through that yourself. And at the time that I'm recording this with you, in 2 days, we're going to promote or premiere our episode on vicarious trauma. That
Mhm.
thing being that close to traumatic events and still having to push through and
Yeah.
see the room and bring in a new patient with a whole different set of problems, even though you still are going through that on the inside.
Yes.
So
And
another, oh,
if
go
I
ahead.
can add, part of my advocacy is also speaking with nurses just to keep them encouraged because they play a pivotal role in the transplantation process. And so what we're saying is that the hospital and the medical professionals who are taking care of you don't know if you're on the list or not. And so once pronounced dead, part of the nurse's responsibility is to call in to the OPO to find out if this person is on the transplant list or not. So before making that call, they have no idea. And so part of the advocacy is just to remind nurses of how important that is because of all of the other responsibilities they have, like you're saying, to continue to care for their patient even after being pronounced dead. And so we just appreciate everything that nurses do to care for us in all aspects of the care that they give.
Yes, thank you for saying that. So with Deidre,
Mhm.
she also has heard people say, "Look, only young, super healthy people get transplants." She's asking you, is that true?
No, not at all. It really doesn't depend on age as much as it depends on your overall health outside of the need for this particular transplant. And so part of my process was to get on the transplant list, I had to do a series of about 31 tests to prove that I was otherwise healthy. And so once I went through the process of making all of those appointments and getting the tests done and the results back, which took about a year to do because I was working full time, right? Um, then I was added to the transplant list. So I thought that anyone who needed an organ was automatically added to the list, but no, we have to prove that we're otherwise healthy to qualify to be added to the list. And then, of course, if you have like a family or a community person who is a match for you, you can also get a donation that way. And it doesn't matter about age at all. It really just matters about the state of your health outside of this need.
Yeah, that's a really good push. We're always telling people to take care of themselves, to eat right, to sleep, to work, manage their stress, not to smoke at all, to minimize how much they drink. It's supposed to be like two a day for men, less than one for women. Not only just for yourself or just for your children. People always say, "Oh, I'll do this for my children," but for your community who might benefit from you being able to lend your organ. It's important for people to know you're born with typically you're born with two kidneys, two fully working kidneys, and they're an amazing organ. Like she said, it got down to 10% where she's now having all these symptoms because that's how efficient it is. It can lose almost all of its function before you recognize there's a problem.
Mhm.
So one kidney is enough for you to still live your own healthy life. So you can donate a kidney and give someone a second chance, and you can still be just fine on your own. And
Yeah.
in terms of your donor, did you ever meet them or know anything about them?
No, I never got a chance to meet them. The only thing that I know about my particular donor is that he was 18 years old and he succumbed to gun violence. And I actually got to meet the young lady who received his other kidney. We actually had surgery at the same time in the same hospital. We checked in at the same time. And we found out later that we had actually gone to the same dialysis clinic for dialysis treatments. We were in the recovery room together. And yeah, so yeah, his family made the decision to donate. And I'm so grateful.
We are too. And what a beautiful uh, next chapter in his life, right? His life ended tragically, but his legacy continues. To
Yes.
the two of you, you're doing a beautiful job by doing that. Now, Simone, you've made it 15 years, and I do want to mention because my dad said something, and so you mentioned the transplant list too. I had taken care of patients who had only been on the list like 2 weeks, and they were
Mhm.
being prepped for to get their organ. Had no clue what a blessing that was, because I also took care of patients who had been on the list 16 years,
Yeah.
still waiting,
Hmm.
still waiting. And so people don't always understand, even though we're promoting the organ, it's a critical thing, right? There still are not enough organs to go around for the number of people who actually need one. And
Yeah.
yes, some people will die still being on the list, unfortunately. And
Yes.
people always want to know, how do you get higher on the list? It has nothing to do with your money. It has to
Mhm.
do with calculations that are made based on your prognosis, where you are right now, and your state of health, and the prognosis that you're going to be able to receive this organ and do the things that need to be done to sustain that organ. You can't go and get us an organ and then smoke and drink and do all these bad things.
Yeah.
Same thing will happen. It will fail all over again. And so there's a lot of questions and examinations and assessments that take place for us to feel as confident as we can that you will take care of this precious organ,
Yes.
right?
And it also matters for matching, and you probably know this more better than me to explain it, but blood type, tissue type, and just several other markers that have to match in order for it to be a match for you. And so in my experience, I got called about 6 or 7 times. Um, but then I started to understand that several people are called for the one organ, and the person who is the closest match of those 4 or 5 is the one who gets it. And so yeah, there are so many factors, and so it does matter if we have a more diverse pool to match with more people.
Hmm. And you can have a loved one. They can go and see if they're a match, and
Mhm.
that can happen too. And sometimes people do. They go and they try to match with their loved one, find out they're not a match for them, but they might have someone on the list. They'll say, "Hey, well, do you mind?"
Mhm.
And sometimes people will do exchanges, right?
Yes,
So
yes,
lots of opportunities there. So you've made it 15 years, and I'm curious because my dad mentioned something that I had never heard of taking care of other patients, that when he got his organ, they said it was only going to last 10 years. And I
yeah.
never heard him say that. And that's why
Mhm.
when I saw your 15 years, I was very encouraged, and I hope he'll be very encouraged when he watches this. Have you ever heard that there's a limitation on your transplant?
Yes, I'm really grateful that I've met my very good friend George Franklin. He lives in Maryland, and he has his kidney transplant for 49 years. And he is the longest living male African American who has received a deceased donor kidney and lived for this long. And so, because I know him, I know the possibilities.
Yeah.
And so, I was recently matched with a transplant doctor who, in our first session, said, "Oh, you've had your kidney for 13 years. We should be prepared to uh, prep you for a second transplant because it usually lasts between 12 and 15 years." I was very upset when he said that because if I didn't know better, I would have been so devastated by that information. But because I knew George and because I had done my own research about how they make that calculation, I wasn't disturbed by what he said. But what made me upset is that if he's telling other people who are not as aware, like how devastating and impactful that messaging can be, right? So the way that it is calculated how long a kidney will last is that once a person gets a kidney transplant, whenever they die, that is counted as how long the kidney has lasted. It doesn't matter if they've died of something that's not related to kidney function. They could have gotten hit by a car. They could have had a different disease. They could have any other reason to die is how long that kidney has lasted. And so there's inaccuracy in that, right? Because if the person hadn't gotten into a car accident and died, then the kidney could have potentially lasted much longer. So it's a flawed way to calculate how long a kidney lasts. And so the possibilities are really endless. And it goes back to how well we take care of ourselves and um, our lifestyle. And we just do the best we can to care for the kidney and live as healthy as possible to give ourselves as much time with our kidney as possible.
Thank you. Thank you for getting into that. If Deidre was sitting here, what would you tell her, as you've demonstrated such a beautiful job, about self-advocacy and how she can show up for herself in those overwhelming doctors and nurse practitioner and PA appointments?
I would say don't be afraid to ask questions. Don't be afraid to ask doctors to slow down, repeat what they're saying, take lots of notes, call back with questions, do your own research. Whatever medicines or medical regimen the doctor is suggesting, do your own research to see if the medicine that they are prescribing, if the description matches what they say that they're giving it to you for. There have been a number of occasions where that didn't match, and so I questioned the doctor and we needed to make some adjustments. Just not being afraid to ask questions or ask for more time, or um, getting to a place where you're comfortable with understanding the information that you're being given, and that you're comfortable with the forms of treatment that you're being offered. And if you're not being afraid to ask for something different, definitely getting second and third and fourth opinions until you feel comfortable moving forward with whatever it is, the treatment that's being offered.
Wonderful. We wholeheartedly recommend second opinions as well.
Hmm. Hmm.
Now, you built a beautiful community of advocacy with One Legacy. How can
Yes.
someone like Deidre or a caregiver get involved?
Well, becoming an ambassador with One Legacy is very easy. It's just a matter of going to their website, onelegacy.org, to sign up to become an ambassador and going through the training, and then you're off to the races. And we have ambassadors of all sorts, recipients like myself, donor families who have lost their loved ones who were donors, and so they want to give back. And we also have living donors who are also advocates as well. Um, we have medical professionals who are impacted by this cause and are ambassadors. So yeah, all
Oh,
help is welcome.
oh, that's wonderful. I love that. What's one thing you'd want Deidre's family and friends to understand about supporting her during this time?
I think the most helpful thing is to, usually when we have people that are experiencing a medical illness or a chronic medical illness, we always say, let me know if you need anything. And I can say from experience that we don't actually do that. So, being more intentional about asking questions of how you can help. So, when is the next time you're going to the grocery store? Can I accompany you there? Maybe they need help with carrying the groceries. When is your next doctor's appointment? Do you have anyone going with you? Do you mind if I keep you company or drive you? So, ask more intentional questions of ways that you would like to help and support, and then Deidre may be more likely to take you up on those offers.
I love that because, I'm kind of guilty of that too. Sometimes we can give people yes or no's, right? And
Mhm.
oh, do you need help? Do you need help? And the answer is no. I don't need help. I'm an adult. I can drive. I'm in my right mind. I have a car. I have the time off. So no, I don't need help. But in this current state, whatever it might be, I want your help. I want someone to be there. I want someone to support me. I want
Mhm.
one less decision to make. I want more free time to look at other resources while you're over here meal prepping or grocery shopping or taking the dog out or sitting with someone else or doing this role for me or showing up at that meeting or
Yes.
picking up that shift, whatever it is. So I want you to be there. And so sometimes, and what I love is we have Chat GPT, which you'll be hearing so much more about AI on this platform. And I want to shout out the Black AI think tank and Black AI literacy. I learned so much by being a participant there. And I am always on the provider side and looking at how we're utilizing it and what we need to be concerned about. But it was wonderful to hear from patients and caregivers on how they're utilizing it. And so you can say, hey, look, I have this friend Deidre. She just got diagnosed with end stage renal disease, and I want to show up. I want to support her. I want to be an advocate. Give me a list of 10 ways I can support Deidre, either financially, physically, emotionally, a prayer I can send her, words of affirmation. So you don't have to overthink it. And even Deidre can take these questions with her to her provider's appointment. So she's
Yes.
not overwhelmed. And we'll get into more on how you can actually utilize AI, but I just want to start to introduce it more into into the conversation. Now, for those of people who are still hesitant about organ donation, but you've pushed them, you've really got their attention today, Simone. What's
Yes.
one thing you can say to help challenge their hesitation to getting on that list?
I would just say to do your own research, educate yourself a little bit more. Part of the reason why people are apprehensive about registering is because there's not enough education around it. We're not having a lot of conversations about it in our communities. And so This was a great start. We've kind of whet your palate of some information, and we've talked about some myths, but continue to educate yourself and read more about it and learn more about it. I'm available to have conversations, if people want to do that. But just continue to be open to the idea. Continue to educate yourself until you get to the point where you've had enough education to make a conscious decision. And of course, I'm hoping that you say yes when you're at the DMV.
We are too, and not only be on behalf of Deidre and Simone and the countless patients, but intimately, personally, my own dad. So this is it's a big deal for me. This is our second episode on transplant. Shout out to Robert Chelsea, the
Yes,
face transplant recipient, and also the winner of our 2024 Social Impact Award because of his story and his testimony that he continues to share so generously,
yes,
the importance of what it means to be a donor and a survivor. So you've mentioned, great segue, that people can reach out to you. So tell us more about the work that you're doing and how we can support you.
yes. I just want to say that Robert is a good friend of mine as well. He is the one that introduced me to your podcast. So we thank
Oh,
him for
Robert.
that connection. Yes, and I'm available on all social media platforms, particularly Instagram, Facebook, YouTube, LinkedIn, at Simone Washington. And if, for those who are listening, that's SOMONE Washington. And I am happy to continue the conversation.
You're a great speaker too. Do you like go and do a lot of public speaking?
I'm starting to. There's been a lot of discussions, book discussions around this topic, and so I would like to do more of it. So thank you so much for that. I really appreciate it.
Yeah, be ready. We had Ashley Wynn Grimes. She talked to us about medical cannabis, and I think within 48 hours, she was invited on a radio talk show. So,
That's awesome. Awesome.
so
Yes, I would love that.
have your
Absolutely.
pitch deck together.
Yes, I especially appreciate how we talked about technology in this episode because I am a technology professional by profession. And so I live in the duality of technology and wellness. And so this is perfect for me.
Yeah, well, maybe you'll have to come back and we can talk more on the tech side and how
Yes.
we can implement it either in this space or another one that you see would really benefit our community, either on the patient side or
Mhm.
clinicians, right? Because you guys can teach us so much that's not in a textbook.
Yes, this was a special treat for me because rarely do I get to talk about this with medical professionals.
Oh,
This this was really great. I've enjoyed every minute of it.
oh wow, this is so sweet. And yeah, you were so excited about the icebreaker and to
Yeah,
know that we have Robert to thank for this opportunity. So yeah,
yes,
we'll have to welcome you into the family and have you come back more frequently. And
I
yeah, we
love
would love to see you get on more stages and things like that. So tell us about your book and who's it written for?
Yes, so the best of all things, a tapestry of faith, hope, resilience, and the human connection. And that human connection piece is how we can help each other in the way of organ donation. And so this is about the 6 year period of my life from the age of 24 and 30 when I got diagnosed. And everything in between, like how I had to advocate for myself for ADA accommodations at work and the challenge that was, surprisingly, how I navigated through romantic relationships as I was going through these treatments, and also relationships with family, and how difficult it is for our loved ones to deal with and manage our chronic illness and everything in between. And so I really wrote this book to encourage those who are on dialysis to keep hope and keep faith that your turn is coming soon. It is also a love story to donor families to give them a glimpse of what life is like for those who have received. And it's also for the support systems and how we can tangibly offer real support and come alongside our loved ones who are experiencing chronic illness, and just to bring more awareness through one story on why it's so important to say yes to organ donation.
Is that a t-shirt somewhere? Say yes.
I'm sure it is. I think I've seen it somewhere. Yes.
Sounds like
Yes.
a good one.
Yes.
Any final thoughts with the audience?
You don't have to wait till you go to the DMV. There are plenty of websites where you can say yes online. OneLegacy.org is one, DMV.org is another. There's a whole list of places where you can register online, and your decision will be honored. And so, just thank you so much for being open to hearing my story and considering organ donation. And just thank you for the opportunity to share my story here on your platform.
Thank you. Our platform doesn't exist without people like you being willing to share it with us. And for those, because, so this is a global show, we have a global audience, but we have a special place in DMV, DC, Maryland, and Virginia. This is a love letter to my home. And so you mentioned dmv.org. That's, what is it? What is the D part?
Department of
Department of
Motor Vehicles. Yes,
Motor Vehicles. So
yes.
for people who don't know, like one of my newest high school graduates, April, she new on the road. Can you just explain to them what the relationship is between the motor vehicle place and being an organ on the organ donation list? Yeah.
Yes. Yes, so the DMV is a place where you go to either get your driver's license for the first time or renew them. And part of that process of registering or renewing is asking you the question of whether or not you want to become a registered donor. And so if you say yes, in some states, like here in California, you get a pink dot that says donor on it. In other states, the symbol is different, and but it's something on your driver's license to say that you're a registered donor. You can decide to remove your name from that list at any point in time if you happen to change your mind. And this is why we say that just looking at your driver's license isn't the best way to know whether or not you're a donor, because you could have changed your status at any point, and your driver's license may not be up to date for that part to know. And so that's why we know that the donor registry is important, that the hospital has to call in to find out, and all of those things.
Well, thank you, Simone. I really can't thank you enough for coming on and helping us really kind of bring home some of the messaging that motivated this show. You did a beautiful job speaking to clinicians, patients, families. You really you brought the donor family into this conversation. People who don't really, they're not typically part of this conversation, right? We're always talking about
Mhm.
everything else. And they're the ones who are really instrumental, especially like in that story you told your donor. He
Yes,
didn't really actually have anything to do with being on the list,
exactly.
you know?
He was very young. He hadn't made the decision for himself, and so his family made the decision. And so this is another reason why we encourage people to decide for themselves, so that their family is not put in a situation where they're having to decide at the same time that they've gotten this devastating news. And so recipients do live in this tension of celebrating our second chance at life, but also honoring the fact that there's a whole family that has lost a loved one in the process. And so this is where we live. So donor families are always on our minds and always in our hearts and always part of our story and our advocacy.
Beautifully said. Thank you so much for your time. We will definitely have you back as a reoccurring guest,
I
and
would love
chat more about what that will look like after we wrap here. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, you can still subscribe, leave us a comment or two, give us a thumbs up. Rate us on the Apple and Spotify podcast. Every time you interact with our platform like that, it lets the algorithm know that this information is important. So that when people like you look for topics like this, we'll show up higher in the search results. At the time of this recording, we release new videos on Sundays at noon Eastern on YouTube and LinkedIn for now. And then we drop the audio at 5 a.m. on all your favorite podcast apps so that our night shift friends can be the first to get something and not the last. We thank you all for watching. We'll see you next time.